thousands of cases in Puerto Rico. Do you have a prediction or a range of how many you expect in the United States broadly?
You know, much of our predictions come from what we saw with dengue virus and chikungunya virus, and those two viruses are also spread by the same mosquito. And in Puerto Rico, they ranged between 25 and 80% of the population getting infected with one or the other of those viruses over the course of one or multiple seasons. In the continental U.S., we have seen travel-associated cases of chikungunya and dengue. We haven't seen large numbers. We haven't seen thousands of cases of locally transmitted disease from the mosquitoes. We've seen dozens of cases, but we absolutely need to be ready. You know, as Dr. Fauci was saying, everything we look at with this virus seems to be a bit scarier than we initially thought. And so while we absolutely hope we don't see widespread local transmission in the continental U.S., we need the states to be ready for that. And that was part of what our summit was about, learning all they could about mosquito control. What do we know? What do we not know? What can we do with the tools that we have today? And how to get ready for mosquito season. When they have a case of travel associated, how to look around that individual for the mosquitoes nearby. We really want the traveling public, when they come back from, Caribbean or Latin America, to use repellent for the couple weeks after they return, because if they silently got Zika infection and they get bit by a mosquito in the continental U.S., that mosquito can then spread the virus. So I don't expect there to be large outbreaks in the continental U.S. I can't give a number to how many cases, but I can say that we can't assume we're not going to have a big problem. We know with other viruses we've had bigger problems than we expected, so we're taking this very seriously.
Do you have numbers for other regions of the world?
What we know from the other viruses is that 25 to 80% of the population may get the infection. We know, for instance, in Puerto Rico right now, they're having dengue virus as well as the Zika virus at the same time, so that makes it even more difficult to tease out what's causing a person's fever and rash. So I would say that in Latin America, we know they're at risk for very high attack rates of the virus. In terms of pregnant women, we don't know yet when you have Zika virus infection during pregnancy, what % of the time the baby will be totally normal and what % of the time there'll be a complication. That's one of the most important questions for us to answer, and teams are working in Colombia, in Brazil, and Panama trying to answer that question, because that's the most important question for pregnant women.
Yep. Thanks, Josh. Dr. Fauci, two for you. One, can you tell me more about the Zika prevention kits and what that entails? And for Dr. Schuchat, how concerned should American athletes be that may be traveling to Brazil, especially as the Olympics come? Are we working on something specifically for Americans that may have that? And I guess I should ask you also another one, Dr. Fauci, about resources. Are you confident that you have what you need to maintain this battle?
Well, I'll answer that question and get the prevention kit to Dr. Schuchat, because that is a CDC thing. The answer is I don't have what I need right now. What I've done is take money from other areas of non-Zika research to start. We couldn't just stop and wait for the money. We had to go ahead for it. The only trouble is if we don't get the money that the president has asked for, we're not going to be able to take it to the point where we've actually accomplished what we need to do. So the answer is we really don't have what we need, but we're still going full blast by drawing money from other areas. And that's how we started. The money that's being transferred over from Ebola account will help bring us a little bit further, but it's still not what we want. When the president asked for $1.9 billion, we needed $1.9 billion.
The Zika prevention kits are being given out to pregnant women in the areas where the virus is already spreading. So in Puerto Rico, U.S. Virgin Islands, American Samoa, there have been about 5,000 kits distributed so far. They include insect repellent. They include information about how women can protect themselves. They include condoms, because we know that the virus can be spread sexually, not just through mosquitoes. They include vouchers for screening materials to help people make sure the mosquitoes stay outside the home and not inside the home, and those sorts of things. We actually initially were considering putting in some permethrin-treated clothing, but then some of our surveillance for mosquito resistance in Puerto Rico revealed that permethrin probably isn't effective, so we didn't end up including that kind of treated clothing. But they're essentially materials and information to help women protect themselves. In terms of the athletes, we know the Olympics is just a wonderful event and that athletes have been training for their whole lives to go there. We really want to make sure people know that if they're pregnant, they should defer travel. We also want people to know that travel to the area may lead to silent infections or infections with symptoms, and that following infections, it's very important to take precautions during sex not to spread the virus. So that type of information has been shared with the Olympic Committee, and of course the CDC is working closely with the Olympic Medical Committee about further advice.
Angela.
Thanks, Josh. For the doctors, are you concerned that by transferring the money from the already appropriated funds last week that reduces the urgency on Congress to appropriate new funds?
Well, it shouldn't, because as I just said, it is not enough for us to get the job done. I mean, it's just a temporary stopgap. If you look at what we need to do both at the CDC and at the NIH, we have a lot of work to do, and that may, in some people's minds, kind of lessen the intensity of it, but in our minds it doesn't, because we still don't have enough to do what we need to do.
Go ahead.
I was just going to say that we also feel a sense of urgency about Ebola and the global health security agenda. Ebola is still circulating in Liberia and Guinea, and many of the vulnerable countries in Africa are having outbreaks right now. And so we know that we have to be, as a country, ready to support response to more than one outbreak at a time. We think that's really important. So we're working as quickly and as deeply as we can on the Zika response while continuing to support Ebola response and recovery.
Chris?
We know the Zika virus is coming to the United States. They're expecting it summer or fall. Is there any sort of mosquito forecast, any way of knowing if it's going to be a worse year than usual for mosquitoes in general? And also, what are you telling travelers, people who are going to some of these countries and returning? Should they be tested, and where can that be done?
The issue of mosquito surveillance and prediction is a really great question, and one of the problems in the past decade or so is that we've really let our mosquito control efforts wither away, and so we don't have the great information that we'd like to have, or even the ability to do better modeling about where in the country the problems are going to be and when they might occur. So strengthening mosquito surveillance before you have to get human disease is a priority for us. So that is something that we're working on, and I think with more resources we could do a better job. I'm forgetting what the second part of the question was.
Telling people who are going.
Oh, testing people, right. Yeah, we do think that if you come back from an area where Zika is spreading and you're pregnant, we recommend that you be tested whether you were symptomatic or not. We recommend testing in the first trimester and then again in the third trimester. In terms of people who don't have symptoms, we don't think they need to be tested, but we think that, who aren't pregnant, but we think that they do need to take precautions with sexual contact, particularly in terms of sex with a pregnant woman. And so we've put out updated guidance on that. We know a lot of couples were asking, well, I'm not pregnant, but I want to get pregnant, and how long do I have to wait? So we put out guidance on that as well, about waiting an 8-week period following travel before trying to conceive for women, and waiting a longer period for men who have symptoms, or in terms of the potential that men can have persistent virus in the semen.
Suzanne?
Doctor, do you think these Zika prevention kits would be useful in mainland United States? And also, do you have a projection on the spread of the Zika virus in Puerto Rico? And to Dr. Fauci, what happens when the stopgap runs out?
Yes, we do think the Zika prevention kits may be helpful in some parts of the U.S., and there was a lot of interest in them from the state health departments that attended the summit. One of the issues to consider is the living conditions. Do people have screens? Do they have air conditioning? We heard that, in parts of Key West, it's very similar to Puerto Rico. People like the windows open and they like that breeze. And so that idea of protecting yourself from mosquitoes that can live inside the house may be relevant here. And then the second question was for you. Okay, good.
Spread in Puerto Rico.
Oh, yeah, okay. Right, yeah, we've got a team working closely in Puerto Rico trapping mosquitoes and looking at where the mosquitoes are that are potentially of concern. They're also testing for resistance. And then the human surveillance. And we are seeing it in multiple parts of the island. It may be that the cases we're seeing reported are just a small percentage because we think some people can be asymptomatic, not have symptoms, and the only people that are being tested right now are people who come in with symptoms. So we're seeing it increasing across the island, and we're worried that as it gets even warmer, it's going to be island-wide.
You know, to be honest with you, I can't imagine that we're not going to be given the money when we reach the point when every time we come in front of you, we tell you things that are more serious. So, I mean, if we reach the point where the stopgap money runs out, again, hopefully that will never happen, but we'd have to start rating other accounts, and very important research on other diseases is going to suffer, and suffer badly. So I just almost can't imagine that would happen, because as we keep talking more, I mean, we just spoke to you about the very interesting issue that we're learning. Again, I'm not an alarmist, and most of you who know me know that I'm not, but the more we learn about the neurological aspects, the more we look around and say, this is very serious. I mean, just in the last couple of weeks, we know not only do you have Guillain-Barré, but you have a case of acute myelitis, you have a meningoencephalitis, and then you have this new thing that was just recently described. We need to get more of the cases to show that it really is associated, called ADEM, acute disseminated encephalomyelitis, which is a multiple sclerosis type of an involvement in the brain. Thankfully, it tends to resolve the way Guillain-Barré resolves, but again, every time we look, we see more and more. So in the context of your question, I can't imagine, as we learn more and more things that are troublesome, that all of a sudden we're not going to get the money. We really do have to get it.
Bill? Dr. Fauci, how did this seem to catch us so by surprise?
You know, it caught us by surprise, not in the sense of we should have known, because for essentially, since the virus was first recognized in 1947 and the first human cases were 1952, it was a relatively inconsequential virus in the sense of a rather mild illness, virtually no mortality, no hints or signals of other things that we're seeing now, for example, the microcephaly, the congenital abnormalities, or Guillain-Barré. And what happened, and we don't have all the answers to this, but when it then had its first outbreak, and the first outbreak was in the Yap Islands, that's when things started to explode, and we still didn't get all the information from them, and only when it hit a vulnerable, big population with a lot of mosquitoes, with people who have never been exposed to this before, did we then start seeing the unfolding of this scenario that every week, every month tends to surprise us even more. But the initial part of it, there was really no reason to be very suspicious that this would be bad. It was one of those viruses that just gave a mild illness.
With the $1.9 billion that House Chairman Hall Rogers said that they plan to continue to monitor this and then fund it as needed, why is that approach not appropriate for this virus? Why do you need that 1.9 upfront as a big bulk of money versus getting it as this progresses and it goes forward? And when is it going to be too late? Is it the first bite of local transmission, or is it some other point when we start to see those numbers swell?
Yeah, we have to do both.
You know, I think, as Dr. Fauci said, we haven't been waiting for the money to act because this is so serious. We've been surging our laboratory testing, for instance. There's a big backlog on that laboratory testing. To really scale up takes time. And so knowing that resources are coming helps with the scale up. There are a lot of commercial partners that are needed for that scale up. Will they actually help without knowing that resources are coming? The vector control, yeah, we have enough money to start on that, but that's an expensive undertaking, the mosquito control efforts. And as I said, we're learning that not all the chemicals or pesticides that are out there will work. There are multi-year studies that are going to be needed for these babies, because we really don't know whether a child that looks healthy at birth will actually not have the effect of the Zika virus. So there's longer-term studies that are going to be needed. So what I would say is that people are acting intensively right now, but that we can't, if additional resources aren't coming, we won't be able to commit to the long-term work that's needed. Then the other thing is the places that the resources were taken from were areas where important work was going on, and I think we're quite vulnerable if we're not able to meet the commitments on the global health security or the Ebola response and recovery.
Yeah.
Dr. Fauci, you
Yeah,
add to that?
yeah, just ditto what Ann said, but also something that I mentioned to this group the last time we were here, that we have a very important partnership with pharmaceutical companies. And if they don't perceive us as a reliable partner, they tend to back off a bit. And that would be the worst thing, because we won't be able to develop these countermeasures completely on our own. So we need to partner with them, and they would get mistrustful if they say, okay, trust us, we'll give you the money later. That doesn't work in industry. Trust us, we'll give you the money later.
Are you seeing any hesitation from industry partners since that money hasn't come through yet?
Well, the answer is thankfully not yet, but I have considerable experience, as some of you may have remembered, back in the time when we were building countermeasures for biodefense, when we were trying to get vaccines for anthrax and things like that. We were trying to bring companies in, and unless we really had the money up front that they knew that we were going to be a reliable partner, many of the important companies backed out. I really don't want to see that now when we need a vaccine and other countermeasures so desperately.
The other part of the question was when will it be too late?
Well, you know, we held our summit with the health departments on April 1st because we know the mosquito season is coming, and we didn't want to wait for money for them to get plans done. But they're going to need to actually develop mosquito control efforts, surveillance, and a lot of difficult tasks. So knowing that there is some resources now is helpful. They're frustrated because some of the resources are coming from other programs that they have. You know, the problem here is that the mosquitoes come, people get infected, and then it's, you know, several months before the baby is born, and we're really trying to protect every pregnant woman we can right now. So we have this double whammy of, you see the febrile illness now, you'll see the horrible effects on the child many months from now, and we don't want to wait for that. We need to act before then.
Perhaps have time for a couple more. Lauren?
First question, Dr. Fauci, you said at the beginning that you were moving money around right now.
Right.
Where is that money coming from? And the second question is there abstinence information in the Zika kits?
Okay, with regard to the moving money around, when you have, the fiscal year is going to end at the end of September, and we have money that's planned for other things. That could be malaria, that could be tuberculosis, and we have that money that is going to go into the projects that are going to just continue to progress the way they are. We're taking that money and now spending it on Zika. And if we don't refurbish that money, those programs are going to stop when they reach the point when they run out of money. So that's what I mean. What we're trying to do is keep everything going, but you reach a point when you don't come in and backfill it, that things stop. And that's what I was referring to of my concern.
What are those programs?
Well, there are several. I mean, I can tell you what we likely would do. One of them would be malaria. The other one would be universal flu vaccine. The other one would be tuberculosis, things like that.
The guidance that we've issued for pregnant women and for couples in terms of preventing the sexual spread of Zika virus include both condoms and abstinence. The actual wording in the materials for Puerto Rico I'm not sure of, because I know we were doing focus testing for the appropriate way to message.
Richard?
Dr. Fauci, can you tell us a little more about, rightfully you insist about women who want to become pregnant and pregnancy, but can you just tell us a little more about neurological disorder, the Guillain-Barré syndrome,
Yeah.
and how dangerous is it for the rest of the population? And at what point will it be necessary to tell people try to avoid going south?
Okay, so I'll address the part about the neurological, and then I'll have Dr. Schuchat talk about what recommendations likely may or may not come out. The issue is we're seeing these case reports of things that we had not seen before with other similar viruses. I mentioned the acute myelitis in a young person, an 81-year-old man who developed meningoencephalitis, and now the 2 cases of what they're calling ADM. We don't know what the denominator is of that, so that's the reason why you do these prospective cohort studies and you do surveillance studies, which the CDC and others are trying to get exactly what is the extent of that. Are these just outlier cases, or when you look very carefully, are you going to see a lot of them? The concern we're having is that at the same time we're seeing the clinical manifestations in people, everything that we do in an animal model or in an in vitro cell line is bad news. The most recent of one, when they put Zika virus into neural stem cells, they have these things called organoids, which are kind of a pseudo brain formation, get completely destroyed by the Zika virus. And then they have a variety of other things that are related to the neurological system. It appears to be very toxically neurotropic, and that's the thing that's concerning. How that relates to how many of the clinical cases we'll see, we just have to keep our surveillance up.
All right, John, I'm gonna give you the last one.
Oh,
sorry.
just in terms of the additional travel guidance, we base our updated guidance on the best information we have. At this point, we have enhanced travel recommendations for pregnant women, saying that they defer travel or consider deferring travel. I can't promise that we would never have broader recommendations, but we'll base it on the best information we have. So far, Guillain-Barré syndrome in the background or the general population is fairly rare. If this is truly causing an increase, it still may be relatively uncommon, and so an individual needs that information, but it may not lead to us saying don't go.
John, I'll give you the last one, then we'll let the doctors go.
Okay, thank you, Josh. Dr. Schuchat, you mentioned the spread of the epidemic in Puerto Rico and its seriousness. Now, there have been reports from Haiti that it's growing very seriously, and that the problem is compounded by a reluctance of people to report and say what problem they have at medical centers. What precisely are you doing with Haiti, given its proximity to the United States?
Yes, you know, Haiti is a key country for us. We've been working closely with authorities in Haiti since before the earthquake and following the earthquake on intensive support for the public health system there. We share concern about Haiti. The mosquitoes are there, the virus is there, and the population is quite vulnerable. And so we do have a CDC country office in Haiti that's working together with the authorities. It's essentially the same principle as what we're doing in Puerto Rico, that people need to be protected against mosquitoes, particularly pregnant women. And of course, care is not really going to be as strong there. We don't have specific treatment, but you know, if you got Guillain-Barré syndrome in Haiti, it would be quite difficult. So we share the concern and are working with our CDC counterparts there.
All right, thank you, doctors, for coming. Nice to see you.
Thanks, John.
Nice job.